Hi, I'm Midwife Judy from Rockhampton Hospital. Welcome to Antenatal classes online. We know that it's not always possible for everyone across our health service to attend antenatal classes in person. So we've designed this condensed version of our 4-week program just for you. Unfortunately, we can't include some of the fun activities and demonstrations that we would do in a group setting, and you're not going to be able to benefit from the sharing of stories and experiences from other prospective parents. So forgive us if it's a little bit death by PowerPoint. We will try to address many of those frequently asked questions, and if any of this content raises additional questions for you, please don't hesitate to contact your maternity service and speak to a midwife directly. The 4 basic aims that we have for these sessions are: 1, to increase your knowledge about your body and how you birth and care for your baby so that you'll have the confidence you need to make informed decisions. We want to help you feel a little more familiar with our local maternity service and the facilities that we can offer. We also want to be able to provide you with information about breastfeeding to help you make this a more successful experience. And finally, we want to encourage you to explore more information about all these topics so that you can meet your specific and individual wants and desires. I encourage you to have a pen and paper ready so that you can record some handy tips or write down some of those topics that you want to research more in detail. We will be providing 4 sessions to you, each of which will take less than an hour to go through. Session 1 is the process of normal labour and some physiological facts about birth. Session 2 is about managing the sensations of labour, how we work in partnership with you, and we'll discuss some of those unplanned birth events and complications. We'll also take a virtual tour of the Rockhampton Maternity Unit. Session 3 is all about breastfeeding, and our lactation consultant Belinda will inspire you to choose this gold standard method of infant feeding. Session 4 is all about after the birth, how to care for your newborn and yourself in those first few days. We'll have our physiotherapist discuss postnatal exercise, and we'll have our child health nurse talk about the support services that are available in the community once you go home from hospital. Pregnancy and childbirth is always a topic of hot conversation and gossip, and everyone seems to have advice for prospective parents. Now, while Facebook and those mummy blog sites might be really interesting, they're not always the best source of information for you because they tend to be full of horror stories and exaggerated tales. You may have heard the following myths. For example, if you suffer from heartburn, they say your baby has lots of hair, or going for a bumpy ride or eating spicy food might get your labour started. And they also say that once you've had a caesarean section, you always have to have a caesarean section. And these statements are simply not true. So it's time now for some solid facts. This is a graphic of a pregnant torso. Let me point out how all this fits together in a woman's body. So let's start with the baby, usually head down in a sack of water in the uterus, or we might say womb. The baby is attached to the umbilical cord to the placenta, which is attached to the lining of the uterus. The uterus has an opening at the cervix, which is at the back of the vagina. Note the 3 openings in the pelvic floor. The vagina is in the middle. The anus at the back is the opening for the bowel. The urethra is the opening to the bladder at the front. It's no wonder then that pregnant women have a number of common discomforts. As the baby grows and grows, more and more pressure and displacement is placed on the woman's spine and all those other organs, causing a range of new experiences for her. I like to consider this model like a motel analogy. The womb is your motel, and your baby is the motel guest. At the front of the motel is your cervix, which is the reception, and the vagina is the entrance and exit to the motel. Now, the guest in the motel gets fed by room service, which is the umbilical cord, from the gourmet kitchen, which is your placenta. So when the guest notifies reception that it's time to check out, reception prepares the bill and gets them ready for departure. The motel then does its work to get the guest out of the motel at the right time, and then the motel cleans up after the guest is gone and gets ready for the next guest. Now you, as the manager of your motel, will do your absolute best to make your guest feel safe and comfortable. and this is why you're making really healthy choices during your pregnancy. Labour is the work your womb does to deliver your baby. Labour involves rhythmic uterine contractions that thin out and open up your cervix and then progressively push your baby out. Your womb can practice these contractions in preparation for real labour, and many women experience tightenings, or Braxton Hicks as we call them, before labour starts. Now, in the movies you often see a pregnant woman suddenly collapse and clutch her abdomen with pain. But this dramatic start to labour is not usually the case, as it's more a subtle building up of discomfort over time. So my advice is, give what you are experiencing the test of time. Your body is going to give you plenty of messages about what is happening, and the signs will become more obvious over time. So what are the signs of labour? Your cervix is sealed with a mucus plug. A show is this mucus plug coming away. So this may occur slowly so that you hardly notice it, or it might be a very obvious thick blob of mucus on your underwear. It can occur many days before true labour starts, but it is a sign that the motel reception desk is preparing your bill. Now, uterine contractions say that the checkout process has begun. Some women describe contractions as feeling like period pains, and others feel more discomfort in their back, and some women feel both. But in both cases, when you place your hands on your tummy, you can feel the uterus tightening and relaxing under your hands. When the bag of waters around your baby breaks, it means that the length of time that your baby can stay in the womb is limited. You know you can't stay in a motel when the plumbing's broken. It's important that you note the colour of the fluid that's leaking from your vagina and put a sanitary pad on so that it can be observed. Note too the time that it happens, because all of this information helps inform us make decisions about your ongoing care. Contractions in true labour tend to develop a pattern of regularity and become more frequent and strong over time. They occur in waves. You can feel each one start to build up, peak, and then slowly subside. Strong contractions can last for 60 seconds or more and can occur 3 or 4 times every 10 minutes. So if you're timing your contractions, time from the beginning of one contraction to the beginning of the next. And if you're timing the length of the contraction, it's from the beginning of the contraction to when the pain subsides at the end. Normal labour is progressive. The contractions progressively build, the cervix progressively opens, and the baby progressively descends. This is confirmed during a physical examination by your care provider. We want you to come to hospital at any stage of your pregnancy if you're concerned about your baby's movements being less than what they have been, or you're experiencing another worrying symptom. We want you to come if you're experiencing signs of true labour before you get to 37 weeks of pregnancy. We want you to come if you're having vaginal fluid loss or bleeding, or if you're getting strong regular contractions or needing additional help to cope with the pain. Before coming in for whatever reason, you will have contacted the maternity unit first to discuss these points with a midwife. You'll be given advice about the necessity and/or urgency of coming to hospital or not. We want you to trust your instincts, to contact us if you're concerned. In many cases, we will ask you to come in for assessment. In Rockhampton, we ask you to come straight to the front entrance, then up to maternity on floor 2, unless birth is very imminent. Birth is not usually an emergency, but if you think your baby is coming very fast, then we encourage you to go to the emergency department so that we can help you from there. If your labour is happening very fast at home, then you're wise to call an ambulance. But you know, most times you will have plenty of time to drive to the hospital, park your car, walk up to the maternity unit long before your baby is born. Always telephone your maternity unit or caseload midwife when your labour has established. We like to know that you'll be coming so that we can be prepared for your arrival. Collect your medical records, allocate a room, allocate a midwife, and greet you with expectation. Remember to bring your pregnancy health record and everything you need for you and your baby. Our normal visiting hours are 8 a.m. to 8 p.m. for the postnatal ward. So, Who will you meet when you arrive at the hospital? Maternity care is very much about teamwork. Your main carer will be a midwife. Midwives are experts in normal. So we provide clinical care, education, and psychological support. We are partners with women. Obstetric doctors are experts in abnormal. So if your labour's uncomplicated, they won't be involved in your care, but they're always available if we need them. Your support people are experts in you. They know you well and provide that emotional and psychosocial support that you need. So make sure that you bring someone with you who you want to share that birth experience with. There may be other staff involved in your care, and you have the right to know who's caring for you. So please know that we will limit the number of people in any one room at a time to keep everyone safe. It's time now for a little physiology lesson. It's important for you to understand how all this works together and how miraculously your body is designed to birth your baby. So we call this the 4 P's of labour: the passage, the passenger, the power, and the psyche. So let's have a look at each one of these individually. So the first P is the passage. The birth passage is your pelvis. The internal dimensions of a female pelvis are like a bowl or a funnel, wide at the top, round in the middle, and oval at the bottom, requiring rotation of your baby's head in order to pass through. Now there's lots of features of the pelvis that promote baby's exit. Firstly, the pelvis is not a solid structure, but a number of bones joined together with joints and ligaments, allowing movement. There's cartilage at the front and back of the pelvis to allow expansion, and the thigh bones, which are connected to your pelvis, act as levers to widen the outlet of the passage. The coccyx, or your tailbone, if you're not sitting on it, can also flatten out to further increase the space for your baby to move through. The passage also incorporates the muscles and tissues of the pelvic floor, which hold all of the organs within your pelvis. These muscles have a role to play in helping your baby rotate through the outlet. Doing your pelvic floor muscle exercises during pregnancy and beyond will help them do their job well. Knowing all these features about your pelvis should make you choose positions in labour where you're upright to gain advantage of gravity, or in a forward-leaning postures with your legs flexed and open with no pressure on your tailbone. Some examples are standing, one-legged kneeling, on all fours, or on your side if you need to lie down. Staying upright and active and changing positions in labour really helps your baby through the passage. So the important point is that your pelvis has been designed to move, change shape, and accommodate your baby out into the world. The next P is, of course, the passenger, and that's your baby. Now, your baby is not a passive participant in birth, but an active partner in this process. Your baby's head is the largest part of their body, and thanks to gravity, it's ideally the first part to enter the pelvis. Because babies are cocooned in the womb in a flexed or curled up posture, they usually enter the pelvis with the top back of their head first. This is where the occipital bone is. In this position, they present with the smallest diameter of their oblong-shaped head, going through the pelvis more easily than other diameters of the head. The bones of the baby's skull are soft, and because they've not yet fused together, they can override each other to fit the shape of the pelvis. We call this moulding. Moulding causes that cone head appearance of newborns, which quickly changes to a more natural shape in a day or so. You can find lots of resources on the internet about optimal maternal positioning. So write that one down, optimal maternal positioning. The third P is power. The power of labour comes from the uterus. The uterus is a very strong muscular organ with a very big blood supply, and it's lined with the placenta. It holds your baby in a sac of that fluid in a nicely flexed posture. The hormone oxytocin that you produce in labour works on the muscles of the uterus, contracting them to firstly pull up the cervix, thin it out and open it up. Then secondly, to push out the baby. The bigger and more regular the contractions, the more work gets done. And after the baby's out, the uterus uses its power to clamp down, compressing the blood vessels and placental site on the inside to control bleeding. How amazing is that? It pulls up, it pushes down, and then it clamps down to control bleeding. To understand this concept, you can try this little demonstration at home. If you blow up a balloon and put a sticker on it, slowly deflate the balloon and you'll automatically see the sticker peel off. And that's exactly how a placenta comes off the wall of the uterus. It's basic physics. And now we come to the final P, your psyche. There's an indisputable link between your mind and your body. What goes on in your head definitely physically affects your body's response to stimuli. In labour, your thoughts and feelings can have a significant impact on your birth experience. You already know that mental rehearsals are often used by actors, orators, athletes, and performers of all types. Positive thinking and mental preparation can definitely improve performance as powerfully as negative thoughts and self-doubt decrease performance. You've all heard of performance anxiety. If you're extremely frightened or fearful, your brain sends out adrenaline, which interferes with the hormone oxytocin. Too much adrenaline can stop your labour from starting. It can stop it once it has started, or it can force it to happen too quickly. There is much evidence to prove that a woman who understands what's happening in her body, feels in control of her situation, and works positively with the work her body is doing, will have a better experience of her birth than one who's excessively frightened, doesn't know what's going on, and resists the sensations of labour. So we're going to talk more in the next session about how you can use your psyche to help you cope with labour. So let's have a look at the 4 stages of labour. This information is helpful because you'll hear your midwives talking about the stage of labour you're in. First stage of labour goes from when your cervix thins out and opens up completely to about 10 centimetres. Second stage is from being fully open to when your baby comes out. Third stage is from the birth of your baby to the delivery of your placenta. And the 4th stage is those first few hours after birth. So how long will all this take? This is just an example because every woman is unique and every experience will be unique, possibly for every birth that you have. Although labour progress can be quite unpredictable, there is an average, and this timeline guides how clinicians help you. Even without doing physical examinations, the stages of labour are often able to be observed in a woman's behaviour. Midwives become quite expert at reading these behaviours. In the pre-labour phase, some women may get more Braxton Hicks contractions and demonstrate what we call nesting behaviours. They get this extra energy to prepare the home environment for baby, cleaning and sorting, and they're often a little restless. Many women have insomnia in the nights prior to labour. Please note that this is not something that needs to be remedied. It's your hormonal system preparing for what's ahead. Don't be tempted to use medication to fix these pre-labour symptoms. This graphic shows the progression from no labour to early labour. On the left is the cervix before labour. It's long and thick and closed. On the right, the power of the womb through contractions has pulled up the cervix, completely thinning it out, and it's ready to start opening. We call this effacement. This is early labour and can take a long time for first-time mothers. Try to ignore these mild tightenings, which will last 20 to 30 seconds and possibly be irregular for many hours. They may become more intense and frequent when you're upright and moving around, but they might stop when you lay down. You may want to spend most of this time trying to relax or be distracted. Keep your diet and fluid intake normal. Remember that work is being done. It just takes time. In this graphic, you can see the progression from early labour to active labour. On the left, the cervix is completely thinned out, and then in the middle picture, it's open to about 5 centimetres. We say that you're in active labour once your cervix is 4 to 5 centimetres dilated. It may have taken many hours to reach 5 centimetres dilation. The woman's behaviour changes in active labour. The contractions usually demand her full attention. She's working harder and becoming more focused on the task at hand. Her contractions have increased in frequency and length and strength. Her breathing rate and depth often mirror the rise, peak and fall of the contractions. She often closes her eyes to concentrate during contractions. She'll not feel hungry, but will need frequent sips to drink. Think about all the things you could be doing to help yourself during this time. Listen to what your body needs. Keep changing positions. Soak in the bath. Spend time in the shower. Have someone massage your back. Focus on a breathing rhythm. People instinctively hold their breath when they feel strong pain, but it's important to breathe deliberately during the contractions, deeply and slowly so that your baby stays well oxygenated. Towards the end of first stage labour and the woman is about 8 to 9 centimetres dilated, she enters what we call a transition phase. Some women, not everyone, feel sick, shaky, they become irritable, they don't want to be touched, they feel like they've lost control, and some women say they just can't do it. She may also say a few things that you've never heard her say before. It's helpful for your partner to recognise this stage as normal and to have realistic expectations about this change in behaviour and the sense of helplessness that comes with it. This is when many women ask for more pain relief as they feel they just can't do it. Transition can be overwhelming, but it's a short stage, and very soon you'll become focused again on pushing your baby out. When you recognise the behaviours of transition, take heart. Your baby is nearly here. As soon as the womb is fully open, about 10 centimetres dilated, you've entered second stage, and it's different to first stage. The contractions may slow down while your baby descends through the passage. Wait for your body to signal it's time to push. Pushing is a reflex and should not be coached before you're ready. First-time mums may take an hour or two to have their baby descend onto the pelvic floor. Then at some moment in time, you'll make a guttural out-breath and instinctively bear down as you feel that pressure in your bottom. The feelings of loss of control settle with the urge to push. Women who've been panicking and screaming before now may become more focused and alert and develop a determination as they understand the task at hand. You may feel the urge to bear down 3 or 4 times per contraction, each of which are longer and stronger but less frequent. Your baby moves further down the passage with the strength of the contraction and then recedes back between contractions. This toing and froing allows the tissues of the pelvic floor to stretch and relax, and it's gentler on the baby's head. As the baby's head emerges from the vagina, this is the time to listen carefully to your midwife, who will guide your pushing effort to protect your skin as it stretches. There is some relief when the head is born. 1 or 2 pushes later, when the baby's body is born, the relief is enormous. The wonder of it all is overwhelming, and the joy of hearing your baby cry is incomparable to anything you've ever experienced. Please watch next this animated process of birth in motion. Note the progress of labour. Note the baby rotating through the passage and out into the world. As your baby emerges, there is an awe in the room. Moments of wonder at the miracle of birth. It never ceases to amaze everyone present in the room, no matter how many times you've seen it. In some situations, dads can help catch their baby and/or cut the cord to share in the physical arrival of your newborn. Some dads, however, prefer to stay at the top end of business, keeping eye contact with their partner to share in the emotion. This is your choice at the time, but we encourage you to be as involved as much as you feel comfortable. This is where I like to remind dads that it doesn't hurt the baby when you cut the cord. There's no nerve endings in the cord. It's also a very thick and gelatinous cord, so sometimes it takes a few snips to cut through. Remember that you're not going to be responsible for creating an outie or an innie belly button by the way that you cut the cord. There will be 2 clamps on already, so your midwife will guide where you need to cut. After the enormous relief of the baby's body emerging, the pressure and pain has eased, but the womb cannot stop its work yet, as it needs to continue to contract to expel the placenta and then clamp down on those large blood vessels that have previously connected mother to baby. We will ask for your consent to manage this third stage of labour with an injection of syntocinon to help minimise bleeding. This injection is an artificial version of the hormone that's kept your labour going. Please do some reading about physiological management of your third stage to make an informed choice about the conditions that would make this a safe alternative. We always wait for the cord to stop pulsating before it's cut. Its job is now finished. These pictures of placentas show two different views. On the left, the views from the baby's side. On the right is the side of the placenta that was attached to the mother. We always check your placenta to make sure it's complete and then it's discarded. Now, some mothers choose to take their placentas home, so I encourage you to talk with your midwife about the conditions that are required for you to be able to do this. Fourth stage is the first few hours after birth. Your baby will have been lifted onto your abdomen, and if baby's alert and vigorous, will be placed up on your chest for cuddles. It's an ideal time for uninterrupted skin contact with your baby for at least the first hour. Imagine the journey that your baby's just gone through and the reassurance that he or she would feel hearing mummy's voice close to their ear and hearing her heartbeat again. Skin-to-skin contact with your baby is best practice for newborn care for many reasons. Remember that your baby will be born wet and naked and in an air-conditioned room. They can become cold very quickly. Mother's skin temperature is increased from her labour, so skin-to-skin contact will help your baby stay warm. It'll help start off that immune process and help you bond with your baby. During fourth stage, your midwife will also check your perineum to see if any stitches are required. She'll check how your womb is clamping down to control the bleeding, and she'll check your vital signs. Baby will usually self-initiate nuzzling at the breast, seeking that first feed. We will be doing frequent observations on your baby in the first 2 hours to see how well they adapt to being on the outside. About 90% of babies don't need any help to adjust after being born. About 10% of babies need a little bit of help to become vigorous and breathe easily, and 1% of babies need active resuscitation. So that's why we always have a second midwife there in the room when you're birthing, so that we can care for both you and your baby at the same time. So how can you be prepared for this life-changing event? We encourage you to choose healthy lifestyle choices. Exercise moderately and adopt those postures for optimal fetal positioning. Practice relaxation activities and mindfulness. Read extensively to be well informed. Develop some realistic expectations and choose a positive mental attitude. Take responsibility for making decisions and trust your body to do its job. Your body has been designed to birth your baby. The less we interfere with natural processes, the more likely you are to have a normal birth. Before requesting or accepting any interference with natural processes, always have a discussion with your caregiver about the benefits versus the risks, and if there are alternatives to the treatment option, including doing nothing at all. So I encourage you now to round off this session by looking at some normal birth videos that celebrate this amazing rite of passage for women. There are plenty of videos on the internet for you to choose from.